to his office, but I know he's got audio.
Okay, just a second. I want to. Okay, we're ready to go.
Okay,
I'm still listening part of the meeting, just no video yet.
Oh,
great.
good.
Thank
Hi,
you,
Scott.
Commissioner Lemons. So I know we are profoundly impacted by the loss of Chair Boggs. I will ask us to reserve our comments in his memory until our police commission meeting next Thursday, where we will be joined by members of his family and his partner, Sandy. So we will look forward to having that time to reminisce about Chair Boggs and pay tribute to his legacy. Since we have a lot to cover today, as well as 2 guest speakers, which Holly was able to procure for us, I wanted to jump right in with the welcome and the follow-up items from our prior meeting. So by the way, welcome to the March 7th meeting, our new Thursday afternoon cadence. So the first thing we needed to do was, I believe, do we need to approve the minutes, Holly, or just say that we received them? I reviewed them and I have no objections to them.
We need to just, talk about it. If anyone has any corrections or edits, voice that now. Otherwise, we will need to approve them. And I did want to let you know that we do have a new notes recorder joining us today. Her name is Lydia Harvey. And so she is on here. Welcome, Lydia. And so she may have questions as we go through the meeting here, since she is new, but we want to welcome her.
Okay. Oh, and is she in the audience? Is that why I'm not seeing her?
She is, yes.
Okay, thank you. Commissioner Parham and Commissioner Lemons, is there any comment on the minutes?
No yeah, I had one change I'd like to see made is when Chief Skinner was asked about the whole Officer Cardwell issue. I think he had told us something along the lines of I'll be addressing it at the meeting on Thursday, and therefore skirted addressing it there. So it says that we asked, but it didn't really say what his response was, and I think that should be in there.
I do see that under discussion of email from former EPD Officer Kirsten Cardwell. Thank you for bringing that up, Commissioner Lemons. Commissioner Parham?
I would just second that omission.
Okay, great. All right, so we'll request that addition be made to the minutes. And Holly, how does that work when we have a new recorder now? Is the new recorder able to make that?
She will make note of it, but then I will go in and go back to those notes and I'll make that edit.
Okay, wonderful. Thank you. So one thing that we needed to discuss, and we'll come back to the General Police Commission meeting, is the current lack of requirement for a post-critical incident mental health evaluation. And for a refresher, what that means is that the state currently allows 6 months for an individual who's gone through a critical incident to undergo mental health treatment. The requirement is that the agency provide at least 2 opportunities to receive treatment or to have an evaluation. Currently, for EPD, there is no requirement to have that evaluation performed before the officer is returned to regular duty. And so this is something that I do want to bring back to Police Commission so that we can strongly recommend a policy be in place. What are your thoughts or recommendations for that process?
I personally would like to see a more streamlined response and a more systematic response to the health evaluations. I think it would be nice to have some official executive guidance in place in terms of how the department will actually handle the evaluations.
So I know we will be hearing from PSRT in a little bit. Holly, what are the chances that Sergeant Smith would be able to attend one of our meetings? I know she has some upcoming outage from the office, but if she would be able to attend one of the subcommittee meetings to provide some, maybe with the first draft, or maybe some other policies that we could mirror for the language on this. I would like to take this to Police Commission as complete as possible. I know that's asking for a lot, But I would like to have something that's fairly easy for the commission in general to vote on. And so I think having Sergeant Barong's assistance with that would be immensely helpful.
Yes, duly noted. She is going to be out of state traveling from, I think, this week until I think she comes back in May. So it's a while before she gets back. So
She will be working 1 day a week remotely though, won't she?
well, not to share all of her personal information, but she may be in remote areas where she won't have access to the internet. So it's kind of iffy. But
and when does she leave for that? I'm just wondering if we can ask to have anything at all to review at least at our next meeting.
I think she's headed out this week.
Good for her.
I know.
I'm happy
I
for
know.
her. I can't even be mad, honestly.
Yeah.
Okay. So we may need to table that. The reason for the urgency on this particular one is because I would like to have this passed through our committee and through the police commission so that the chief has it when he returns to the bargaining table with the union, since it will also have to go through them. And I would like our part of it to be as complete as possible before he takes it to the union. So we can follow up on that to determine how to make that happen.
When is the union bargaining again?
I believe it begins this fall, but I don't know.
Yes, that's
Okay.
correct.
Thank you.
And then would it, Commissioners Parham and Lemons, do you think it would be helpful at all to meet with a representative from the union beforehand, or maybe that's completely out of our purview to tell the truth?
I think it would be helpful just to see what type of pushback there might be.
Holly, do you think maybe we could ask Navasha, Officer Tester, to join us? I know during the day she's a school resource officer. And so I don't know if that would work with her schedule, but maybe if she would be willing to join us or at least weigh in, that may be helpful for us as well.
Yeah, definitely. And if she's not available, we might be able to have someone else from the union step in and
that would be great. Yeah, Officer Tester or Officer Clues, any of those that have that familiarity would be fantastic. As far as the EPD culture for female employees, there was the news segment that aired on KVAL last night. I noticed it's also been picked up by KMTR, and I imagine it will proceed to other news outlets as well. Prior to Chair Boggs' unfortunate passing, he had actually granted me the authority to speak as the chair's designee on this particular topic. And now that he is no longer with us, I will be taking point on that particular topic. So at our General Police Commission meeting next week, we will have presentations by Leah Pitcher, the Independent City Auditor. We'll also have some words from Councillor Jennifer Ye as far as the appropriate process for the commission when we receive reports of this nature that could necessitate some escalation. And then on the other side of it, I have pledged that our committee will continue to ask for updates. Obviously, as human beings, we all want to see things get better. We are definitely constrained by our charter from the City Council as far as what we are and are not allowed to do. But I think that Leah's information that she'll provide to us next week will hopefully help provide some of those guidelines for us. Additional comments, William or Scott?
None at this time.
Okay.
Yeah, not at this time. Thank you.
Okay. Well then, look at us. We're already ahead of time. I like this. Holly, in our packet, I saw that you sent us a fantastic sample PHQ. So I will turn this over to you to tell us what we're looking at.
Right. So, and hopefully in your packet, you read the part in here that I put about the personal history questionnaire summary and exactly what it is. And okay, good. So you're familiarized with that. So basically it's a piece of, it's one component of the hiring process, and people go through sworn staff going through the application process, and it's designed to help public safety agencies carry out background investigations more efficiently. And it consists of a lot of questions. As you can see, there's over 255 multiple choice questions that the applicant must answer. And it's done through an online portal that the City of Eugene contracts with, so a vendor. And then the answers, once the applicant submits those through the portal, they're put into a report format that summarizes the information. And then you can see the topics that are addressed are education, employment, military experience, law enforcement, driving record, financial history, legal history, substance abuse, and just general information. Once that information is compiled, it's summarized, and then it goes through a list of criteria, and there's critical, serious, and whatnot. And then there's a overall score that is attached to it. And then once that's done, it will go to our vendor that we use. And we have someone from the public, sorry, we have Dr. Ryan Roberts here that will be able to speak a little bit further about this. He's with Public Safety Psychological Services, and he is on our Zoom right now if we want to invite him over as a panelist, unless you had questions.
Before we do that, Holly, can you tell us who the accrediting organization is that administers this particular questionnaire?
Right. It's Johnson Roberts and Associates.
And are they statewide? Are they national? What's their credentials?
They are national.
Okay.
They work with all various law enforcement agencies throughout the country.
Okay. Is it safe to say that this particular version of the PHQ that we're looking at, is that used as a fairly standardized, I guess, questionnaire for a lot of or most law enforcement agencies? Or is this something that is crafted specifically for EPD?
I believe it's pretty standard. Now, when I spoke with our Employee Resource Center director that provided me the PHQ, she did let me know that, for instance, Oregon, we are updating our PHQ to be in line with DPSSE standards. And so the vendor will work with us to add that in here to make sure that we're in compliance. I know she said that the state of California had a bunch of changes that came out of their legislature that they're working on with the vendor to get that updated for the state of California. So I think that it can be tweaked for states that has specific needs to meet criteria.
Please refresh my memory on DPSST. They are through the state of Oregon, if I remember correctly, but they also do they work with other agencies besides municipal, state, and county law enforcement? So for example, do they work with any, like, say, security guards at Target or anything else like that? Or are they specifically for official law enforcement?
I can't answer that specifically. I know they work with the tribal, police departments and throughout the state. So I think it's just law enforcement, but I cannot be certain, but I can check and get back with you to let you know.
That would be fantastic.
Okay.
William, Scott, any other questions before we welcome Dr. Roberts?
And at the moment.
Thank you very much.
Jensina, do you want me to pull him over?
Can I ask a question about page 8? So it talks about the key to the information in parentheses. And math was never my strongest subject. And so I'm having a hard time understanding how these percentages are being related. And maybe that would be a question more for Dr. Roberts.
I would defer that to Dr. Roberts.
Okay, excellent. Well, then we would love to welcome Dr. Roberts to the table.
Okay. Oh, I'm trying to get him to move over. Promote panelist. Well, there we go. Just a moment.
Sure.
Here we go. All right.
Good afternoon, Dr. Roberts. Welcome to the committee.
Thank you. Good afternoon.
Thank you for your willingness to come and share with us some of your processes.
Sure. Should I start with answering the question about the percentages?
Before you do that, can you please give some of the background of who you are and why we invited you to the meeting?
Sure. I am a co-owner of Public Safety Psychological Services. So the primary managing partner is Cerise Fablé, who does most of the work, but she is on her way out of the country right now, so I'm joining in her absence. I'm also involved in Johnson Roberts and Associates, so I have knowledge about the PHQ as well.
Perfect.
And
Glad we're here.
I'm actually based in California, so I run that portion of our business, and we do very similar evaluations for many public safety departments down here as well.
Okay. At what point does the PHQ come to you for review?
The PHQ typically is actually done by the department, so the department receives it at the very outset of the background investigation, and the purpose of that is so that they can review it and save money. If they have disqualifying admissions, then they don't have to go through the whole background process. At that point, if we're doing only a post-offer evaluation, sometimes we'll get the PHQ at that phase when we come into the process. Typically, we actually have a separate questionnaire we use that is more broad than the PHQ. The PHQ is a pre-offer instrument and doesn't really get into medical information. By law, we can't give anything that relates to medical information prior to the conditional offer of employment. So we will actually use an extended version of that called the psychological history questionnaire. And it goes into things like drug use and abuse, as well as psychological treatment history.
That's fascinating. Thank you for explaining that. Can you please break down for me the percentages that we see in the parentheses, and keeping in mind that I'm not good at math?
Okay, let me try to pull up an example here.
Percentage of respondents making that response, followed by percentage of respondents making that response or one that is worse. I see. And then the problem points assigned to the response. Okay.
So in terms of, I'm actually looking at a PsyQ in front of me, but I believe it's the same format. This is really, the percentages here depend upon the question. There is some there is ambiguity with regard to what is similar or worse. Some questions don't really break down into that type of category, and some responses have more options than others. But in general, this is the PHQ is a multiple choice instrument. So the first percent is just the percent of the sample that actually endorsed that specific item. And then based on the author of the test, they would categorize all the items in basically a order of best to worst. So then the other percent is how many endorsed that item or worse. So, if they're talking about how many drinks of alcohol they consume on a daily basis, it would go up from there. That would be a numerical listing, which is easier to quantify in that way, but some of the others would not.
So then when a candidate comes to you for evaluation, you may have their PHQ involved. You also have the separate questionnaire that's more medical in nature. And then when you meet with the candidate, can you tell us about your process for evaluation?
Sure. So when the psychologist meets with the applicant, we have our entire test battery. That includes these two instruments, but it also includes a test of normal personality functioning. We use the California Psychological Inventory. That's the most widely used test of normal personality. And we use the Personality Assessment Inventory for the test of psychopathology. That is best practices, the industry standard. In California, it's mandated by law. And then we have another instrument, the State Trait Anger Expression Inventory. That is a very brief instrument focused just on anger expression. It tells us whether the applicant experiences anger more so than the average person or the average applicant to law enforcement positions. It's very face valid, so it's somewhat easy to fake, but when we do get responses, it is meaningful. It can be used as corroborating data for other test results or historical admissions. In addition to that, we have a supplemental history questionnaire. So as it's relevant to this discussion, but things change over time. Different topic areas become more important. For example, bias, certain sexual impropriety. We've brought in some of the questions and included it in that separate form. And that's more adaptable, and we can add to it as we go. So all of that together is available to the psychologist at the outset of the interview. They're supposed to review this ahead of the interview, and they come up with basically hypotheses about the suitability at that point of the applicant, and also different areas that they're going to inquire to in more detail during the evaluation. We use a standardized template to conduct the evaluation, which roughly follows the PHQ and PsyQ in terms of the categories. So as they're going through the interview, we're reviewing that same material and making reference to these instruments, the PsyQ and PHQ, as you go. So that's how we use those instruments in the process. We use it to guide a semi-structured interview.
Commissioner Parham, I see your hand is raised.
Yeah, I was just curious, could you repeat the California specific test? And then to piggyback off of that, are any of these tests any of the tests that you're discussing right now or describing, are they used in Oregon for pre-employment purposes?
Yes, so it's not a California specific test. The name of it is the California Psychological Inventory, and it is used in Oregon widely. It's the most common test of normal personality functioning used throughout the country by a large margin. It measures things like how dominant the person is, or whether they're timid, how responsible, impulsive, reckless, whether they follow the rules and norms of society or organization, how tolerant they are, things like that. And that's opposed to a test of psychopathology that measures things like depression, anxiety, paranoia, that sort of thing.
Thank you.
How long does your initial evaluation usually take? Are we looking at a 1 hour session or longer than that?
It really depends on the applicant. So we try to make everything a minimum of 30 minutes with the interview, but it really is tailored to that applicant. So if there are areas of concern, it will go longer, and it can go up to an hour. Usually at that point, we have another one scheduled. So it is kind of a hard stop at that point. If there's nothing, they certainly can go longer than that. It just really depends on, if the person has an extensive criminal history or problems on the job, personality conflicts, terminations, you have to go into each one of those and get important details that are relevant to the suitability of the applicant. So it can get longer when the person has issues.
What sort of things would be considered disqualifying factors, or when combined would be disqualification groups of factors?
Sure. So we use as a criteria for determining suitability the California post dimensions, and that's not mandated, of course, in Oregon, but they are pretty much adopted by default throughout the country. We use them with our other clients, and I know our other colleagues use them with their clients in various places around the country, from New York, DC, Chicago, most of the Pacific Northwest as well. So any one of those dimensions can be grounds for disqualification. I wouldn't say disqualification, it's an unsuitability finding based on our evaluation. So the department isn't legally required to adopt our recommendation and disqualify them. So we would never actually disqualify somebody, but being a high risk on any of those dimensions could be grounds for a unsuitable recommendation. So those dimensions are things like emotional regulation, stress tolerance. So if the person has significant elevations on the testing, and we have corroboration from their behavior, it could be, for example, getting into multiple fights recently, or having personality conflicts on the job, arguments, things like that, road rage experiences. Substance use is one that's kind of a moving target. Historically, any recent drug use could be something that we would take extremely seriously. Marijuana has, of course, become more normative, the use of it. And we don't necessarily take that as anything that would be necessarily unsuitable, but recent hard drug use, for example, LSD, cocaine, methamphetamines, very recently, would be something that we would take very seriously, and that may lead to an unsuitable finding by itself. Let's see. Social competence is another factor. I mean, we can go up through each one of these, but these are the most common ones. Social competence is one that's very important. bias or tolerance is a subcomponent of that. So if there is evidence that they've engaged in explicit forms of bias that's documented historically, for example, using ethnic or racial slurs recently, posting content on the internet, these are all things that we ask about in the interview. That could certainly be grounds for an unsuitable finding. Additional corroboration from our testing, the CPI cycle, the California Psychological Inventory. They have low tolerance, low empathy. Those are scales that would go together with the history-based findings and perhaps result in an unsuitable finding. Conscientiousness, dependability, another big one. If they have repeated terminations or disciplinary actions at work, that would be a serious issue that may result in an unsuitable finding. And then another common one is integrity. So integrity, that is probably one of the most common reasons that we would have an unsuitable finding. That could be lying during the process if we get information from the background or just the background investigation that they told them one story about their history, and then we find out they omitted it entirely when they talk to us. That's a very serious integrity issue. Or you could have just historical admissions of integrity violations like stealing from your employer, things like that.
What is your process for submitting your findings to EPD? Does it go to EPD or does it go to the city of Eugene? How does that work?
I am actually not entirely sure about that. I would have to check with our administrative staff. I don't personally submit the findings to the department or the city. I know sometimes we have verbal communication about the findings with the department. So I'm not sure exactly who gets the information first.
Commissioners Lemons and Perm?
No,
Okay.
no questions. No questions at this time.
I got a few there, Commissioner
I knew
Hawkins.
you would.
Yeah, well, hopefully at least it's a little later in the day. Dr. Roberts, what investigation is done to look up or verify the answers on the PHQ, if any?
We will review most of the content of the PHQ verbally in the interview. But in terms of verification, we would have to rely on information obtained from the department. We don't do any independent verification like a criminal records check or anything like that by ourselves. So it really comes from information obtained in the background in communication with the department. In the state of Oregon, I believe there's no polygraph permitted. So that would be a very important piece that we use in other states to verify that information. But we don't have that in Oregon. So it's, in our opinion, unfortunate, but yeah, we just have limitations there. We can only do so much.
So in your opinion, do you see using a polygraph on applicants as a best practice or a good practice?
I do. And I think there's kind of a misunderstanding about how the polygraph is used. We don't, in certain circumstances, it's not admissible in court because of the reliability of it. But typically the way it's used in law enforcement evaluations is not as a test of whether or not somebody's being truthful about that thing directly. But, they're certainly under stress. They have the instrument attached to them. They can see their responses, their bodily responses, and they're more likely to tell us the truth. So in those circumstances, we get more admissions and we can use those admissions that they made as being truthful, and we can compare that to the results we get. If somebody gets a reaction that they have, suspect behavior, or I think they call it some type of, I can't remember exactly what the terminology they use, but they can determine from the biological response that the question may or may not be truthful. If that's a finding, that is not an automatic unsuitable recommendation. We do not take that the answer of the polygraph in terms of being truthful or not as a definitive. One caveat is that if they are showing active countermeasures, so for example, some people will bite their lip or maybe have something in their shoe or have certain breathing patterns, that's evidence of them actively trying to conceal the truth and kind of derail the polygraph. And that is, of course, something that we would take into account.
Great, thank you. Also, what is the background of the practitioners that conduct these interviews? Or do they primarily see law enforcement as their primary clientele, I guess is what we would say, or do they come from a more diverse working environment?
It really depends on the evaluator. Some of us, like myself, 100% of the time we devote to working with public safety organizations, and we mostly do assessment. Some of us also do some limited treatment or some work and wellness programs, but primarily many of us do assessment for public safety, so that's our specialty. This is a specialty area within psychology recognized by the APA. So even those who only do this a portion of the time have to be trained up by us to be competent in this specialty area.
Great, thank you. And lastly, from my perspective, on average, how much is the cost to a department for one of these processes?
On average, throughout the, would you say throughout the country, or
from your perspective, or I mean, if you know how much EPB is actually paying for these, I'd prefer that. I just don't think you were in that position.
Yeah, I don't know exactly what they're paying under the current rate right now, but on average, it's about high $400s to $500 per evaluation.
Awesome. Thank you very much, and thanks for being here.
Yes, thank you.
Dr.
did
Roberts,
actually-
oh, sorry, Commissioner Farron.
No, I'm sorry. I just was curious, what short gaps, if any, you see from the questionnaires?
Sorry, could you say that again? It broke up a little
Like what shortcomings you see, if any, from the actual questionnaire? Like, are there areas that could be improved, or are there areas that this doesn't really shed light on that may come back later after hire?
Good question.
I think there are definitely some areas that could use improvement. I'm not sure how that could be done necessarily. Part of the problem is that the questions are, they're obvious in nature. The people they're trying to get a job, they know what the right answers are. So it's difficult trying to get at the source of the information, the real information you want. For example, bias is a good one. Everybody knows that you're supposed to not be biased. So they just say they haven't done anything X, Y, Z through the questionnaire. Same thing goes for sexual impropriety. Those are probably the two biggest areas we have trouble assessing. In some part, we can rely on our psychological test instruments because they're not as face valid. They don't directly ask a question about, for example, using racial slurs. They're more indirect. So we can get some data from that. Not so much in the area of sexual impropriety, but a little bit more in the areas of bias. For example, the tolerance scale doesn't directly ask about racism, but it does get at that construct. And I would say in this area, the polygraph could be a tool. Outside of Oregon, we work with our agencies to have consistent questions so we can compare the responses between what they tell us or the backgrounders and what they tell the polygrapher. And if we, standardize those questions between all of those groups, we're more likely to get a truthful response during the polygraph or active countermeasures. And then we would have an integrity concern, which could be used to disqualify somebody.
Thank you, Dr. Roberts.
How are your findings weighted, Dr. Roberts? So is an applicant considered, is it a flat pass, no pass, or is it a 16 out of 20 would recommend? How does that work?
We use a graded scale internally, which is a A, B, C, C minus. Those are all pass range, and then D and F are fail. So we do convey information more granular than pass or fail to the department about the risks associated with the candidate. But at the end of the day, it is a pass or fail recommendation.
Excellent. Oh, all right. We will let you get back to your day. Thank you very much for joining us. It was actually incredibly eye-opening having all this information. I feel like I've been drinking out of a fire hose for 20 minutes. So thank you very much.
Thank you. Thank you. Have a good day.
Chair Hawkins,
Yes.
I wanted to follow up. I reached out to Chief Skinner via text, and he said that yes, private security and private investigators have to go through DPSST to get certification.
Okay, that aligns with what I had thought. So that's good to know. Thank you very much, Holly.
You.
Commissioners Parham and Lemons, any questions or comments before we move to PSRT?
No, thank you for your time, Dr. Roberts.
All right.
And not at the moment. Thank you.
Great. Holly, we would love to hear from Emily.
Okay, I've just promoted her to panelist. She's going to be joining here in just a moment.
Fantastic. Emily, where are you going?
I'm sorry, I'm at a work conference up in Portland, so I'm
gosh.
on my
Thank you so
mobile
much
phone.
for
Sorry.
stepping away to join us. We appreciate you being here.
Yeah, no problem.
All right, in 20 minutes or less, can you give us the breakdown of the incredible work that your team is doing?
In 20 minutes. Well, our team, I don't know how much background you guys have on our team. It's made up of professional staff and foreign. Right now we're sitting around about 32 members. The national recommendation is that you would have at least 10% of your workforce represented on a peer support team in order to be effective. So
let me back you up just a little bit. And let's, for public record, can you please tell us what PSRT stands for?
Yeah, PSRT is Peer Support and Resiliency Team. So our main missions are twofold. One, to provide peer counseling to department members, and the second is to help with resiliency and employee wellness. So it's kind of a really, really broad mission. And in the past, and when I say past, like 15 years ago when I joined the team, it was a critical incident response team that only responded to large incidents, and it was really reactive. We're now trying to shift those gears in the last 5 years and really become more proactive and do trainings and offer other wellness type things so people can actually build a toolkit for resiliency. Because, you know, what research really shows is that if you don't build resiliency in people and have them have daily practices and lifestyles that are around wellness, that when a traumatic incident happens, you can throw everything in the kitchen sink at them as far as resources and support, but they won't be able to bounce back from it as well as if they had those resiliency practices embedded into their lifestyle. So really the bulk of the work that we try to do is on the front end. And we have been doing that in a variety of ways. So the most common thing you'll hear about with peer support, obviously, is the confidential peer counseling that we do. And there is an Oregon revised statute, a law that protects that confidentiality, but it has to be within the guidelines of that ORS. And what that includes is it has to be someone who's working in one of the disciplines that are listed. So a foreign police officer is listed, an emergency dispatcher is listed. But for example, we have people on our team that are not included in that, like a community service officer or a records specialist. So they're not under the confidentiality umbrella protected by law. And then they also have to be certified through the state or through a national academy of some sort in critical incident stress management. And then they have to be working in a peer support capacity. And then that would be confidential, which means that the contents of that conversation couldn't then be brought into court through a subpoena or used in an internal investigation. So what that does is it allows department members who are experiencing stress, either work-related stress or personal stress, to go to a peer counselor, have a confidential conversation, and have it stay between them. So that's a bulk of what we do. The other thing that we do is critical incident stress debriefs, and those are ran by our team. They have a mental health professional present. They have a chaplain present, and that is a process that was originally started in the military and is now used by lots of different industries to basically just process the emotional distress and trauma that comes along with critical incidents. It's not a tactical debrief. It's not a fitness for duty. It's just simply allowing those employees a time to get together, talk about the incident, and hopefully process it in a really healthy way. And so we do those frequently throughout the year for different incidents, large and small incidents. And then the other piece that we do is that building that resiliency through wellness. So promoting different things. This coming year, we're going to be hosting for patrol in service, and then the rest of the department will be invited as well. We're going to do suicide awareness and prevention training. We're going to do another resiliency training in June. In next year, we hope to offer a financial wellness training. And then we just finished up a cardiac screening. So employees could volunteer to participate in it and get a full cardiac screening, because cardiac health is one of the main concerns with first responders because of all of the constant stress and adrenaline dumps that occur to your body when you're working in first responder work. So what happens is you get an adrenaline dump and it actually puts stress on your heart. And so after time, it creates a lot of cardiac issues. And that's why so many first responders die from cardiac disease, either late in their career or early into retirement, more so than die from suicide or line of duty deaths. And so we offered cardiac screening for anyone who wanted to participate in that, and they were able to get a free confidential cardiac screening, and then also support for any follow-up care if they needed to change their diet or change their exercise routine or anything like that, or seek medical treatment from their doctor in order to resolve an issue that's like lying in wait, to hopefully prevent a cardiac event down the road. So we just did that in February and finished that up. So those are some of the things that we're doing, but we have lots of other projects that are kind of hanging out there as well.
What was the participation in the cardiac screening? Would you say at least half of the eligible folks, or fewer, more?
So I don't know how many employees we currently have. I think between about 320 and 340, depending on any given day. We budgeted for 125 spots, and we had 103 people sign up. There was a little bit of a short time frame just because of how it worked out with getting the contract signed through the city and the dates that were available. I think we would have got a little bit more participation if it was announced a little bit earlier. But yeah, we had about 103 people participate. So, about 1/3 of our department.
That's excellent, especially for being voluntary.
Yeah. And it's most departments, like it was offered for Oregon State Police and Oregon Department of Corrections with the same agency. Several departments have offered it in our state, and about 40% is the participation at a voluntary basis. So we were just under that. But I've had a lot of people approach me since that and say, hey, I talked to so-and-so. They had a great experience. Like, I wasn't available during those dates because I had a work conference or whatever, but if you bring it back, I definitely want to do it. So there was a lot of interest in that, which is good.
Commissioner Parham, Commissioner Lemons?
Yeah, I had several questions. The first would be what type of ongoing training is offered to PSRT members, and then how often is like a recertification process happening?
So the initial required training is a critical incident stress management training, and it's for individuals and group settings. So that's to do one-on-one peer counseling, and then also to do a critical incident stress debrief. It's a 3-day course. All of our members have to have that basic course. There's nothing on a state level or an EPD level that requires any training beyond that. We've talked about, we had a couple people go like, hey, I'm on the team for 8 or 10 years. I'm going to go to a refresher course and take it again. And we've talked about like, what are maybe some baseline requirements we want to put in place for ongoing training, but we don't have anything in policy. However, we have, since I've been the supervisor for the last 9 years, offered several trainings. Our people do lots of trainings online about employee wellness, suicide training. 2 years ago, we had Stephanie Kahn, who is a psychologist that has a practice up in Portland, come in and talk about how to efficiently run peer support teams. And then she's coming back to our team actually this month, and our entire peer support team is going to do a 4-hour class on suicide intervention and how to deal with employees who are suicidal, because our team has dealt with several police officers and non-sworn staff that have been suicidal in the time that I've been the supervisor. So we are doing some focused training, but there's nothing currently in policy that says, hey, you have to have this many training hours a year, or this is required by state.
As a supervisor, what trainings would you want to see included as like a standardized for the department?
Well, I think crisis communication is big, because we deal with a lot of people in the department that are in some sort of crisis. And we also, I didn't mention this, but our care also extends to EPD family members. So that includes like household members, spouses, significant others, children. We also deal a lot with EPD families. And that is a big piece that I don't think our team has as much training or preparation for. So that's a big one. Suicide intervention obviously is a huge one, because that's such a high risk event that we don't deal with super frequently. So those would be the two biggest ones that I think would be important. But there's endless amounts of wellness training, anything from fatigue management, which seems silly to go to, but I've been to a 3-day class just on how to manage fatigue, because it's such a huge thing. It affects so many pieces of first responders' lives. So like there's lots of topics, nutrition, exercise. I can think of tons that our people could get knowledge from and use that in their interactions with others.
And then my last question is, being so close to that 10% of of EPD being trained to be PRST, what do you think it would take to get more department buy-in to get that number to 10%?
So we've been there before. It kind of fluctuates. With retirements, we have had several people retire and then also leave the department. So our team's been as high as like 36, and it's been as low as 28 in the time I've been a supervisor. So part of it is just onboarding new people, and then with retirements, so we've kind of floated around that 10%. When I took over the team, we had 12 members. So it was grossly underneath, but we've kind of fluctuated around that. We've also talked about the idea of having a full-time wellness position in the department, and how could we fund that? Someone that is dedicated to running peer support and running wellness programs. I mean, I spend a lot of time doing this as my side gig. This isn't my full-time gig, but I could definitely have a full-time gig just doing trainings and setting up debriefs and things like that.
Thank you. Thank you very much.
You're welcome.
Commissioner Lemons.
Thank you. So you said that the recommendation is roughly 10 per workforce. Whose recommendation is that?
10%,
So that's
right?
like it's just a nationwide standard. Like that's what they kind of say. I believe that came from I forget the exact name. It's the International Peer Support Foundation, and that's the foundation that puts out most of the recommendations in regards to peer support teams and critical incident stress management and first responders. Just that if you want to be effective, you really need to have at least 10% of your staff dedicated to doing this work. If you have a workforce of 350 people and you only have 3 people on your team, there's no way they can properly care for them. So that's kind of what the standard is.
And are these volunteer positions? Do their schedules get adjusted so they could have the capacity to do this work?
So it's considered an ad hoc team, just like SWAT or any of our other special teams. So it's in addition to their regular work. However, the peer support policy does allow for them to be adjusted or detached to do peer support work if they're directly supporting an employee and that's needed. So like if they're on duty and we have a critical incident and the sergeant's like, hey, we need peer support to come check in on this person or talk to this person, or this person has requested peer support, because an employee can request peer support at any time. They can contact a peer counselor confidentially without going through their chain of command. They can call a peer support person. So they might call that peer support person in off of their regular duties and say, hey, I need you to have a peer support conversation with this person or check in with this person. So that happens frequently. If we have a critical incident stress debrief and our people need to run that, they'll be detached and from their regular duties to do that. And so we first try to do that with people on duty, and then there is chances where they come in off duty and they get paid overtime in order to do those functions. It just depends on the availability. But yeah, policy does support them to do that. It also supports people who are attending. So if you were involved in a critical incident and you want to go to the critical incident stress debrief for that, and it is occurring during your regular shift, policy states that you will be allowed to attend and your position will be backfilled if necessary for you to attend. And that happens frequently.
Okay, thank you. And also oh, what's up, Polly?
Sorry, I have a question when you're done. Sorry to interrupt.
Oh, okay. To drill down a little bit more on the certifications, I understand there's the 3-day course on critical incident stress management. Is there also a peer support specialist like licensure that is being kept and updated? Or is peer support being used in a more loose manner than I'm maybe anticipating?
I'm not sure I fully understand your question. We are keeping training records on our people as far as them being trained. Yeah, I'm not sure exactly what you mean by that.
No, I can clarify. So I'm a peer support specialist over at Lila, and we have to keep our registry through the Oregon Traditional Healthcare Workers Registry and keep all of our paperwork up to date. And they're the ones that do, make sure that our certifications and our trainings are up to date. I was just wondering if there's a body above EPD that is wearing out for this, or is that all like within EPD and your team?
That's just within EPD. There's no body statewide that's tracking that. Each individual peer support team for their department develops their policies and procedures and tracks their training for it. So as the supervisor, it's my job to make sure that there's no uncertified peer support counselors that are doing work. So right now we have 4 people that have been selected for our team. They went through a selection process. And they've joined our team, and they're coming to meetings, they're coming to trainings, but they're not doing any direct work. I'm not assigning them any check-ins. I'm not having them run any critical incident stress debriefs. They're not certified through critical incident stress management yet. So they might shadow another member to see the work being done, but they're not doing it. So it's like just on EPD to manage that we don't have people doing that work that shouldn't be doing it. But no, there's no body that governs that. We do have a regional committee right now that was started by Dr. Stephanie Kahn. She was in former law enforcement. She then left to become a mental health professional and started her own practice. It's out of Portland, first responder psychology, that works exclusively with first responders. And she's written books. She speaks nationwide. She has written a lot of the best practices for peer support teams on a nationwide level. She has started a regional group here in Oregon that includes myself that is looking for ways to create some best practices so that teams are doing things more consistently, so that we're sharing information, and that we're creating mutual aid agreements so that if we have a line of duty death at EPD that affects our entire peer support team because they knew the person that was killed, that the teams in the surrounding areas would be able to come in and help support us and provide support for their department. So we're creating those practices, those policies, and those kind of mutual aid and contact databases. So some of those things are in the works, but it won't be an official body or organization that governs it.
Thank you. And I have one more, but Holly, go for it, because mine said it's a bit tangential.
Oh, I know that this was a question that Commissioner Booker had at our meeting last month. He was hoping to know what kinds of critical incidents EPD you guys assist with. Like if you could give us some examples.
Well, critical incident is a really broad term, and what's critical for me or traumatic for me might be different than what's traumatic for something else. So it can be anything from an officer-involved shooting to an infant death. It could involve one employee, or it could involve 20 employees. Generally, you know, and I always say an emotionally significant event. And that means it's emotionally significant for that involved employee, right? And it might be emotionally significant because they just had something in their personal life that this is now hitting a chord with, and that's why it's traumatic. So we provide support for all different types of things. We also provide a lot of support for personal issues, a death in the family, a sick child, a divorce, financial hardship. There's all kinds of things that we provide support on. As far as formal debriefs, those are generally incidents that are going to involve multiple disciplines like dispatch and police, maybe fire, or several employees, like an officer-involved shooting, a fatal crash, a juvenile death. We've been doing them on all juvenile deaths because they're extremely traumatic to our people. So that's generally what would trigger us doing a formal debrief.
With the rules that you have regarding confidentiality, how do you alert EPD if someone is going to need to be given a release to not return to their post for a while?
So we have a traumatic leave policy that allows for up to 36 hours after a critical incident for people to be off of duty paid by the city, and that can be triggered by 3 ways. A supervisor can offer it if they see a need that the employee could benefit from time off. The employee can ask to take time off, or a peer support person can advocate on their behalf after a conversation that I think this person would benefit from time off. And that is a pretty low threshold, like, hey, they were involved in this incident, I think they need to be off. Okay, it's granted. They are given paid administrative leave. It doesn't come out of their own personal banks. And the hope is, research says, that 72 hours and 2 REM cycles of sleep that is going to help process trauma and stress. And the hope and theory behind that is if they're off for, you know, a day and a half, then they would be able to come back, feel well enough to return to work. So that's one way that happens. Another way that happens is if there is a report of suicidal thoughts, or we believe someone is actively suicidal. That is a mandatory reporting situation in our ORS. So, like, out of that confidentiality, then we're mandated to report that up the chain of command, and we've had to do that, and we just articulate to the employee that, you know, it's going to be a mandatory reporting situation. So we'll still help them get the help that they need, whether that's time off or going in for a formal psych eval, getting in with a mental health professional, whatever it is that they need. But that's reported up the chain, so their chain of command is involved in that. And then there's an even further piece, which is like a fitness for duty, and that's something that's generally initiated through the Employee Resource Center, through HR, and that's down the road. If someone has an event, or they're off for a certain reason, like they filed a psychological injury or something like that, and they have a mental health professional or a medical doctor saying, hey, they need to be off work for a stress-related injury, then at some point they might be mandated to do a fitness for duty evaluation, and that's mandated outside of our team. We might support the employee in that, but we're not directly involved in the mandating of that.
Go ahead, Commissioner Lemons.
Oh, I was off mute the whole time. Sorry about that. Yeah, so lastly, how and when does the PSRT and maybe the supervisors of the PSRT decide that a situation is out of their skill set and training and calls in a licensed clinical social worker, psychiatrist, or other professional?
So unfortunately, right now, there's no contracted mental health professional with the city. That's something that we're working on securing funds for, to have an on-call person. We have a citywide employee assistance program that's more of an 8 to 5 Monday through Friday that we can call. And we have some mental health professionals that we vetted through our team that are familiar with first responders that we refer people to in the community. But our job as peer support people is really to support, to listen and refer. So that's what we do. We're not providing mental health treatment. We're not trained mental health professionals. We say that in all of our training. We tell people that. So we constantly are referring people, and whether that's to their medical doctor, to mental health professionals, counselors, to rehab, to to lawyers, to other resources. And so we have a pretty extensive kind of file of resources that we can refer people to. And that's kind of on our peer support counselors to know, hey, this is kind of beyond what I can talk. This isn't just like a, hey, let's go grab dinner and kind of decompress and talk. This is going to be beyond that. And if they need additional resources, then they'll contact me as the supervisor and say, hey, this person needs some additional resources and referrals. What can we do for them? And kind of working through that with them. So there isn't any one threshold, but we do referrals frequently. And that's something that we work on all the time. I would love to have a first responder EAP, employee assistance program, and that's something that we're writing a federal grant for EPD to try to secure funds to try to contract with a first responder EAP that would have the ability to be called out after hours and have some on-call capacity. Like if we had a suicidal subject, they could come and do an evaluation on them. And they specialize just in first responders. And if it's up to me, if we get the grant money, that's where we would spend the money on a contracted licensed mental health professional and on a first responder EAP.
Point of orders, Commissioners Lemons and Farham, I'd like to move to extend our meeting by 5 to 10 minutes to accommodate discussion.
I'm down for that.
Okay, seconded by Lemons. Let's consider it voted unanimously, please. Thank you. Emily, that's a lot of information. I have a feeling we're going to invite you back to share more information with us, with what's directly happening in EPD. And we also would love to hear more about the grant. I know it's the same one that we applied for last year and did not receive. Is that correct?
It is the same one. And we're currently doing a survey right now in the department about what we're doing well in regards to employee wellness and some areas that we have some deficiencies, because part of that grant writing is they really want to see what are you doing here and what do you want to do. And so that data is going to help us. So we're hoping that our grant writing is going to be a little bit stronger once we have that data.
Okay. Would you be able to share the survey, not necessarily the results? I understand that might be a separate battle, but would you be willing to share the survey questions with our committee, please?
Oh yeah, certainly. Yeah, I can email. Do you want me to just email that directly to you?
Yes, please. Please send to Holly and she'll send it out to the rest of us.
Okay. Yeah.
Thank you. Thank you very much for joining us, for sitting in your car and joining us while you're busy doing something else. We really appreciate your time today.
No problem. I'm happy to come back anytime. I could talk all day about it. So any information that you guys need, just let me know. Yeah.
Excellent. Thank you very much.
All right.
Thank
Take
you.
care. You're welcome.
Okay, commissioners, it sounds like we got a lot of information today. It sounds like we do have an opportunity to work on policy as far as establishing maybe some baseline training that's required on a renewable basis. And Scott, I'm wondering if some of your expertise in that area, if we might be able to draw on some of that to maybe get some recommendations as far as the industry, not law enforcement specific, but for a peer support specialist.
Happy to do so. Yeah.
Okay. Anything else that you gentlemen, that you folks would like to address before we wrap up for the day? Our next meeting is on April 4th, and I know that I'm sure there will be some emails flying around in between now and then.
Honestly, thank you, Holly, for setting this up. There's a lot of information for me to cram into this head process, so I'm going to reserve my comments for now.
Excellent. William?
Yeah, my comments are I think they need to be developed a little bit more. I do have a question about section 1123.32, the supervisory approval and work hours for the PRST. Because I'm curious how robust and efficient this program actually is in terms of offering the best services to officers.
Thank you. Holly, will you communicate that question to Emily for follow-up?
You bet. Yeah.
Excellent. All right. Well, then, thank you very much for your time today. And Holly, I know you'll get the recording out to us, especially so Dr. Booker can view. And thank you for your time today.
Thank you all very
Meeting
much.
adjourned.
Thank
Take
you.
care.
Yeah.